Hey everyone, and welcome to the Deep Dive. Today we're diving into something that's probably on a lot of your minds, Medicare. Whether you're getting close to 65 or just want to brush up on the basics, this deep dive is all about helping you feel more confident when it comes to Medicare. And trust me, there's a lot more to it than you might think. Like, did you know that missing a deadline could end up costing you extra for years? Or that there are ways to get help with those sometimes really overwhelming healthcare costs? Let's jump right in.
Sounds good. I'm ready.
All right, so first things first, who is actually eligible for Medicare? I think a lot of people just assume it's for anyone turning 65, right?
Yeah, you're right. Turning 65 is the most common way people qualify. But there are a few other ways to become eligible. Like if you're under 65, but you've been receiving Social Security disability insurance for at least 2 years, you're automatically in. And there are certain conditions like ALS or end-stage renal disease that qualify you no matter how old you are.
Okay, that makes sense, especially for those facing some serious health challenges. So let's say you hit that magic age of 65. What happens next? Do you need to rush to sign up for everything?
Not to worry, you actually get a 7-month window called the Initial Enrollment Period, or IEP for short. It starts 3 months before your 65th birthday, includes your birth month, and then continues for 3 months after.
Okay, 7 months, that seems pretty generous. But what happens if you miss that IEP window? Like if life gets in the way and you just forget?
Well, that's where those costly penalties come in. If you miss the IEP for Part B, which covers things like doctor visits and outpatient care, you could end up paying a higher premium for the rest of your time on Medicare. And we're not talking about a small increase either. It's 10% higher for each full year you were eligible but didn't sign up. So yeah, that 7-month window is definitely something to keep in mind.
Wow, okay, I'm starting to see why understanding these deadlines is so important. Okay, so let's shift gears for a minute and talk about the different parts of Medicare. A, B, C, and D. It seems like everyone's always throwing these letters around, but what do they actually mean for, everyday people?
Right. It can definitely sound like alphabet soup sometimes. Let's break it down. Part A is kind of like your safety net for major medical situations, like if you need to stay in the hospital or need skilled nursing care after a hospital stay. It also covers hospice care and even some home health services.
Gotcha. So Part A is there for those big, scary medical events. What about regular checkups and everyday health needs?
That's where Part B comes in. Part B covers those visits to your doctor, outpatient care, preventive screenings to help you stay healthy, and even some durable medical equipment, things like wheelchairs or oxygen tanks.
Okay, so A is for big events, B is for everyday health. What about C and D? Those always feel a bit mysterious.
Things get a little more interesting with these two. Part C is also known as Medicare Advantage, and it's offered through private insurance companies. Think of it kind of like a bundled deal. They combine parts A and B, and then often throw in extras like dental vision or hearing coverage, which, those aren't usually included in what we call original Medicare. Some plans even offer things like gym memberships or wellness programs.
Wait a minute, this sounds a little too good to be true. Are there any downsides to Medicare Advantage? There's always a catch, right?
Well, one trade-off is that you're usually restricted to a network of doctors and hospitals, so you might not have as much flexibility in terms of choosing your providers compared to original Medicare, which generally lets you see any provider who accepts Medicare.
Okay, that makes sense. So it's like choosing between having this really curated experience with some extra benefits but some limitations, or having more freedom to pick your own doctors and hospitals. Gotcha. Right. What about Part D?
Ah, yes. Part D. Part D is all about tackling prescription drug costs, which, let's be honest, can be a big worry for people, especially as we get older. But Part D plans are not all created equal. They vary in terms of which medications they cover and how much you'll have to pay. Choosing the right Part D plan can really make a difference in your budget.
Oh, so many choices. It's great to have options, but it also feels a little overwhelming. How do you actually decide which path is right for you? Original Medicare or Medicare Advantage?
Yeah, I wish there was a simple answer. Unfortunately, there's no one-size-fits-all solution when it comes to Medicare. It truly depends on your individual needs, your budget, and what's most important to you. Some people really value having that flexibility and wide choice of providers, which makes original Medicare a better fit. Others might prefer the convenience and extra benefits of Medicare Advantage, even if it means dealing with some network restrictions.
So no easy answers. It's all about figuring out what matters most to you. All right, but let's say you've chosen your path and you're all signed up. Are you good to go at that point?
Well, not quite. One thing that a lot of people don't realize is that Medicare isn't something you can just set and forget, especially when it comes to Medicare Advantage plans. These plans can change from year to year. Imagine this, your plan suddenly decides to stop covering a medication you rely on. or a specialist you see regularly.
Oh, wow. I hadn't thought about that. So you're saying things can change and not always for the better.
Exactly. Premiums can go up the list of covered drugs they call that the formulary can change. And even the network of doctors you have access to might be different. That's why it's so important to review your coverage every year.
Okay, so how do you keep up with all these potential changes? Do you have to call your insurance company all the time? That sounds exhausting.
Luckily, there's a system for that. Each fall, you should get something called an Annual Notice of Change, or AOO for short. This notice outlines any changes that are coming to your plan for the next year. And don't just skim it. Take some time to really understand what's changing, especially when it comes to those drug formularies. A small tweak there could mean a big difference in how much you end up paying for your medications.
Okay, so the ANOC is like your yearly Medicare report card. It tells you what's changing, and then it's your cue to decide if you want to stick with your current plan or explore other options. But what if you decide you DO want to make a change? You're not stuck with the plan forever, are you?
Absolutely not. You have options. And that's where those enrollment periods we talked about earlier come back into play.
Right, we talked about the initial enrollment period when you turn 65, but you're saying there are other opportunities to switch things up if you need to.
Yes. You've got the Annual Enrollment Period, or AEP, which runs from October 15th to December 7th each year. Think of it like open enrollment for Medicare. During the AEP, you can switch to a different Medicare Advantage plan, go back to original Medicare, or even enroll in a Part D drug plan for the first time.
Okay, so the AEP is like a reset button, giving you a chance to reassess and maybe make changes to your Medicare coverage each year. Are there any other enrollment periods we should know about?
There are a few more, but one that's especially helpful for folks who might be regretting their Medicare Advantage choice is the Medicare Advantage Open Enrollment Period. It runs from January 1st to March 31st each year.
Okay, so even if you miss the AEP, you still have another chance to make changes to your Medicare Advantage plan, or even go back to original Medicare. That's good to know. It's a nice safety net. Now, I know a lot of people get really worried about the costs that come with Medicare. It can feel like a lot to manage.
You're telling me. Healthcare costs are a major concern for many people, but the good news is there are programs designed to help. Let's start with Medicaid. It's a program that helps those with limited income and resources cover their healthcare costs, and it can work alongside Medicare to provide more comprehensive coverage.
That's great to hear for those who qualify. What about prescription drug costs? Those can be so expensive and really put a strain on people's budgets.
Definitely. And there's a program called Extra Help specifically for that. It's designed to help people with limited income and resources afford their medications.
Okay, so Medicaid for general health care costs extra help for prescription drugs. What about those Medicare savings programs I've heard about?
Ah, yes, Medicare savings programs. Those are another great resource. They can help with things like your Part B premiums, deductibles, and co-payments. Think of it like an extra financial cushion for your Medicare expenses.
So we've got Medicaid extra help and Medicare savings programs. All definitely worth looking into if you're worried about costs. Now, there's another piece of this puzzle that's always confused me, Medigap. Can you help us understand what that is?
Of course. Medigap, also called Medicare Supplement Insurance, works alongside original Medicare Parts A and B. It's not a replacement, it's like an added layer of protection that helps cover those annoying out-of-pocket costs, like copays, coinsurance, and deductibles that original Medicare doesn't cover completely.
Got it. So Medigap is like a safety net to help minimize those unexpected costs that can come up with healthcare. That sounds like something a lot of people would be interested in. Can anyone get a Medigap plan?
That's a great question, and it brings us back to another really important aspect of Medicare enrollment periods.
Oh, no, those deadlines again. So does that mean there's a specific time to enroll in Medigap too?
You got it. Enrollment periods are kind of a theme with Medicare, and they're super important when it comes to Medigap. Missing certain deadlines could have some long-term consequences.
Wow, this is all starting to make a lot more sense now. But I'm realizing there's a lot more to Medicare than I initially thought.
Yeah, we've just scratched the surface here, but hopefully you're starting to see that navigating Medicare doesn't have to be this big, scary mystery.
It definitely feels a lot less intimidating now, that's for sure. We'll be right back to continue our deep dive into Medicare. Stick with us. Welcome back to our deep dive into Medicare. Before the break, we were talking about Medigap and how it's like an extra layer of protection to cover some of the costs that original Medicare doesn't. It seems like there's a lot to unpack there.
Definitely. It's a really important piece of the puzzle for a lot of people. So remember, Medigap plans are offered by private insurance companies, but the interesting thing is that the plans themselves are standardized. So they actually offer the same basic benefits no matter which insurance company you choose.
Okay, so if the plans are all basically the same, what's the difference between choosing one company versus another?
That's where the shopping around comes in. Even though the benefits are standardized, the prices can be totally different from one company to the next, so it's really important to compare quotes from different insurers to make sure you're getting the best deal.
I love a good comparison shopping spree, so that makes sense.
Okay.
But back to those standardized plans, how do you even know which one to choose?
Well, instead of having numbers, they're actually lettered. They go from Plan A all the way to Plan N, and each plan offers a slightly different set of benefits. Some might cover more of your copays, while others might focus on covering excess charges. It's all about finding the one that best matches your needs and your budget.
So it's kind of like choosing a data plan for your phone. You pick the one that gives you the right amount of coverage without, spending a fortune.
Exactly. Now, bringing it back to the bigger picture, remember we talked about those two main paths you can choose with Medicare. Original Medicare with the option to add a Medigap plan or a Medicare Advantage plan.
Yeah, that felt like a big decision point, like choosing between two different hiking trails.
And they do lead to very different Medicare experiences. So let's revisit those key differences. With Original Medicare, you have the flexibility to see any doctor or hospital that accepts Medicare. And that's most of them.
So with Original Medicare, I'm not limited to a specific network. I've got options.
Exactly. That freedom of choice is a big deal for a lot of people, but like we talked about earlier with Medicare Advantage, you're usually limited to a specific network of providers.
Gotcha. So I might need to double check if my doctor is in the plan's network before I sign up.
Mm.
Okay, what other things should people consider when they're comparing Original Medicare versus Medicare Advantage?
Well, one of the big draws of Medicare Advantage is that they often have more comprehensive coverage. Things like dental, vision, and hearing are often included, which, aren't usually covered under Original Medicare.
Right, those extras can be a big deal, especially since they can get so expensive. So it seems like Medicare Advantage might be a good choice for someone who wants that extra coverage without having to manage a bunch of separate plans. Are there any downsides to that convenience, though?
There can be. While Original Medicare usually doesn't require referrals or pre-authorizations for services, you might run into those with some Medicare Advantage plans.
Ah, okay. That's something to think about,
Yeah.
especially if you prefer a more streamlined approach. Anything else to consider?
Another key difference is how out-of-pocket costs work. With Original Medicare, you're typically responsible for deductibles and co-insurance for most services, and those costs can definitely add up. That's where a Medigap plan can really help to fill in those gaps.
So Medigap is like a buffer to protect you from those really big bills.
Exactly. Medicare Advantage plans, on the other hand, usually have set copays and a maximum out-of-pocket limit for the year, so you might find your costs are a bit more predictable.
Okay, so let me see if I've got this straight. Original Medicare with the option of a Medigap plan gives you more flexibility and predictability with costs. But it might not cover all of those extras like dental and vision. Medicare Advantage often bundles those extras but comes with network restrictions and maybe even referrals. It feels like there's a lot to weigh here.
There is.
Yeah.
And unfortunately, there's no right or wrong answer. It really comes down to your own needs and priorities.
So where do people even start when they're trying to make this decision?
I would start by asking yourself a few key questions. What matters most to you? Do you value being able to choose any doctor you want? Are you looking for coverage that includes things like dental and vision? How comfortable are you with those potential network restrictions and maybe needing referrals?
Those are all really good points. So it's not just about the plan itself. It's about how it fits into your life.
Exactly. Once you have a better sense of what you're looking for, then you can start doing some research on the specific plans that are available in your area. And luckily, there are some great resources to help with that.
We've already mentioned a few like Medicare.gov and the State Health Insurance Assistance Programs, or SHIPs. Are those good places to start?
Absolutely. Medicare.gov is a goldmine of information. Think of it as your online Medicare headquarters. You can use it to compare different plans, find doctors in your area, and even estimate your potential costs.
It sounds like that website can do it all.
Right.
What about SHIPs? How can they help?
The SHIPs are amazing because they offer free personalized counseling, so you can actually talk to someone who can help you understand your options. Their counselors are trained to help you navigate the enrollment process and make sure you're getting the coverage that's right for you.
That's amazing,
Oh,
especially since it's free and unbiased.
okay.
So we've got Medicare.gov for online research and SHIPs for that one-on-one guidance. Any other resources that might be helpful?
Depending on your situation, you might want to check out Resources from organizations like AARP or the National Council on Aging, they often have helpful articles, guides, and even online communities where you can connect with other people who are going through the same thing.
Those are great suggestions.
Mm.
Now, I have a question that might sound a little silly,
Yeah.
but what if you choose a plan and then you realize it's not the right fit? Are you stuck with it forever?
Oh, that happens all the time. And luckily, no, you're not stuck. Remember those enrollment periods we keep talking about. Those are your opportunities to make changes to your coverage. If you realize your plan isn't working for you, you can always switch to a different one during the annual enrollment period or the Medicare Advantage open enrollment period.
It's good to know you have those safety nets. What about people who are still working when they turn 65? Do they have to sign up for Medicare right away?
It really depends on their situation. If you're covered by a group health plan through your employer and they have 20 or more employees, you can usually delay enrolling in Part B without penalty. It's always a good idea to talk to your HR department or a benefits counselor to understand how it works for your specific case.
Okay, so if you're happy with your current coverage, you might not need to rush into Medicare. Now let's talk about those late enrollment penalties. We've mentioned them a few times, but I think it's important to understand what triggers those penalties and how much they can actually cost.
Yes, absolutely. Those penalties are no joke. Like we said before, if you miss your initial enrollment period for Part B, you could face a penalty that increases your monthly premium by 10% for every year you were eligible but didn't enroll.
And that penalty is usually permanent, right?
Yeah.
So that extra 10% could stick around for a while.
Exactly. It's not just a one-time fee, it's a permanent increase to your premium. That's why those deadlines are so important.
Wow. Okay, I'm getting it now. What about Part D, the prescription drug coverage? Are the penalties for late enrollment there too?
Yep. The Part D late enrollment penalty is calculated a bit differently. It's based on how long you went without what they call creditable drug coverage, and it gets added to your monthly Part D premium. Think of it like a little extra charge for not having consistent drug coverage.
Okay, creditable drug coverage. What does that even mean?
It basically means having drug coverage that's considered at least as good as what Medicare Part D offers. So if you have drug coverage through your job or a retiree health plan, something that's comparable to Part D, you're good. But if you have a gap in that kind of coverage, you'll probably have to pay a penalty when you sign up for Part D.
Gotcha. So no gaps in drug coverage if you want to avoid those penalties. Makes sense. Now, I know life happens, and sometimes things don't go as planned. Are there any exceptions to these late enrollment penalties? Like, what if something unexpected comes up and you have to enroll late?
There are some exceptions. Medicare understands that things happen. So if you qualify for what's called a special enrollment period, you might be able to avoid those penalties. These special enrollment periods are triggered by certain life events, like losing your job-based health coverage, moving out of your plan's service area, or even getting married or divorced.
Okay, so there's some built-in flexibility to account for those life changes. That's good to know. So as we wrap up this part of our Medicare deep dive, is there anything else about enrollment periods that you want to emphasize?
Just this, don't underestimate those deadlines. They can really make a difference in how much you end up paying. Mark them on your calendar, set reminders on your phone, talk to someone who understands Medicare, whatever you need to do to make sure you don't miss those important windows.
Great advice. We'll be back in a moment to answer some common questions and explore some resources to help you navigate your own Medicare journey, so stay tuned. We're back for the final part of our deep dive on Medicare. We've covered a lot of ground today, but I'm sure there are still some lingering questions out there, especially with a topic as complex as Medicare.
Absolutely. Medicare can be a bit of a maze.
For sure. So let's spend some time addressing some of the common questions we hear from folks. We've mentioned some helpful resources throughout the show, like Medicare.gov and those state health insurance assistance programs, or SHAPs. Can you remind everyone why those are so valuable?
Sure thing. Medicare.gov is like your one-stop shop for everything Medicare. Want to compare plans? They have a tool for that. Need to find doctors in your area? They can help with that too. You can even get estimates on your out-of-pocket costs. It's seriously a fantastic resource.
It's incredible how much information is available online these days. And what about SHIPs? What makes them so special?
Well, SHIPs are amazing because they offer free, personalized counseling. Think about it. You have someone to walk you through all the ins and outs of Medicare and help you understand your options. The counselors are trained to answer your questions, explain those choices, and help you make good decisions about your coverage. And did I mention it's completely free?
Free expert advice, can't beat that. Okay, so we've got Medicare.gov for online research and SHIPs for that one-on-one support. Any other resources worth checking out?
Yeah, depending on your situation, you might find some helpful information from organizations like AARP or the National Council on Aging. They often have articles, guides, and even online communities where you can connect with other people who are navigating Medicare.
Those are great suggestions. All right, so let's jump into some of those common questions we've been getting from listeners. One big one is, how do you find doctors who accept Medicare?
Luckily, there's a pretty easy way to do that. Medicare.gov actually has a tool called Physician Compare. You can search for doctors by specialty location, whether they're accepting new patients, all that good stuff.
That's so helpful, especially if you're new to an area or just looking for a new doctor. What about if you're planning to travel? Does Medicare cover you when you're out of state?
Another great question, and the good news is that Original Medicare will usually cover you anywhere in the United States, so you can travel without worrying too much about your coverage.
That's a huge relief.
Yeah.
Are there any exceptions to that nationwide coverage, though?
There are a few. Like if you need kidney dialysis, you'll have to coordinate with a dialysis center in the area you're traveling to. And some Medicare Advantage plans might have more limited coverage areas. So it's always best to check the details of your specific plan before you go.
Good point. A little bit of planning can go a long way.
Yeah.
Okay, here's another question we get all the time. Does Medicare cover long-term care, like nursing homes or assisted living facilities?
That's a big one. And it's important to understand that Medicare's coverage for long-term care is pretty limited. It might cover a short stay in a skilled nursing facility after you've been in the hospital, but it won't usually cover long-term care in a nursing home or assisted living facility.
Okay, so what are people's options if they need that kind of care?
Well, that's where long-term care insurance comes in. It's a separate type of insurance that can help cover those costs.
So that's something to keep in mind as part of your overall financial and healthcare planning. All right, so we've covered a ton of information today. And I know it can feel a little overwhelming.
Definitely. But remember, you don't have to figure all this out on your own. There are resources to help you every step of the way. Use Medicare.gov to do your research. Reach out to your local SHE for that personal guidance, and don't be afraid to ask questions.
It's true, you're not alone in this. There are people out there who can help you make sense of it all. So as we wrap up this episode, is there one key takeaway you want listeners to remember?
I would say be proactive. Don't wait until the last minute to learn about Medicare. The more you know about your options and how Medicare works, the better equipped you'll be to make decisions that are right for you.
That's great advice. Medicare might seem confusing at first, but with a little planning and the right resources, you can absolutely navigate it with confidence.
Exactly. And remember, Medicare is ultimately a tool to empower you. It's about taking control of your health and making informed choices about your care.
That's a great way to think about it. Well, thank you so much for joining us on this Medicare deep dive. We hope you're leaving today feeling more informed and empowered to navigate your own Medicare journey. Stay curious, keep learning, and most importantly, take care of yourself.